annual National Conference of Indian Psychiatric Society is going to be held in Delhi from 28th to 31st January 2026. This is our yearly event that is held in different parts of the country year after year. And this being held in Delhi this year, we are expecting about at least 3 to 4,000 members attending the conference from all parts of the country and also overseas. The psychiatrists, researchers, academicians from different parts of the world are going to discuss. For example, one of the lectures will be on precision psychiatry. Now, there is a move to discuss treatment of patients which is specific and unique to the individual patient, not just very generic kind of treatment.
This year's theme of the conference is Unshackling Psychiatry for Society's Mental Health. And we stand committed to truly unshackle psychiatry, which implies that we will not let anyone disdain either the mentally ill or let anyone judge a patient or his doctor by the prescription that they see. So this year's theme is going to have symposia, it's going to have workshops, it's going to have free papers, it's going to have e-posters, all put together to deliberate various aspects of mental health. And we promise this year we are bringing in all the stakeholders, whether it is not just the doctors, but the patients, their carers, their family. All stakeholders from society will sit together, will deliberate so that we can come up with a document and take it to the government so that the future of mentally ill, the end user, the patient, is then now not shrouded with uncertainty and myth, but has clarity, scientific understanding, and the right appropriate treatment.
The theme is Unshackling Psychiatry for Society's Mental Health. To go back in history, about early 19th century, a gentleman called Philippe Pinel in one of the mental asylums in France unshackled and unchained those inmates of that period who were considered dangerous. So removing the chains and shackles from those who were chained was a huge step. Indeed, it's been called the first revolution in psychiatry. 200 odd years later, while that unshackling has been done, there's a whole lot of other shackles that still trouble psychiatry and mental health to be able to help the society. There is the shackle or the chain of stigma, negative connotations of psychiatry and seeking psychiatric help, legal hassles. There is, of course, the policy and the programmatic funding issues. And so, we in psychiatry believe, and I'm completely convinced about this, human society has missed out on benefiting adequately from all the advances that have been made in psychiatry.
There's about 1 in 10 persons in India approximately has some mental health issue. So if your office has 100 people, maybe 10 people are suffering from mental health issues. The treatment gap is 70% plus. So if 100 people are having illnesses, most of them are not able to reach mental health services. So spreading the education about mental health issues, getting to know that mental health issues are treatable. If you come to the doctor, he can prescribe you medication, prescribe you therapy so that your mental health gets well. So it is a common mental health, a common scenario, and it is a treatable scenario.
Why the patients and family have a stigma? Why do they fear to going to a psychiatric clinic? लोग क्या कहेंगे? पागल clinic पे जा रहा है? People, general population, health professionals, except other than psychiatrists, all the policy makers and general public see psychiatrist and psychiatric illness as aliens.
As far as the Indian Psychiatric Society is concerned, if I remember rightly, it was started in 1947. Since then, we are organizing conferences annually. Current conference is 77th Annual National Conference. And the Indian Psychiatric Society has come a long way. Presently, we have around more than 10,000 registered members in the Indian Psychiatric Society. We have made huge arrangement for that. We have 15 halls, scientific halls, where the simultaneously presentations will be going on. And this time we are thinking on the day of CME, that is the Continuing Medical Education Program, which is the first day of any in our ANCIPS, there will be probably 2 or 3 or 4 simultaneous plenary sessions going on.
This conference is paramount in dealing with the whole idea about how India is going to see the progress of mental health and well-being across the country, especially led by and empowered by the youth in India. So youth and mental health is one important dynamics of this particular conference, which is going to build up the recommendation for tomorrow.
There is a huge gap between demand and supply. On one hand, we are seeing increasing number of mental health problems all over, and I would say it is an epidemic in which there is, on one hand, scarcity of the professionals. On the other hand, there is so much of problems everywhere that if we use digital pathway, then we can actually reach the remotest areas of the country.
We welcome you all to this mega event where people from different countries will be coming and sharing their experiences with the newer treatment regimes, with the newer molecules, with the newer techniques, and together we can benefit so that ultimately the patient improves, the outcome improves, and it helps in upliftment of psychiatry and psychiatry patients.